It was only a matter of time. Omicron, the new variant of the coronavirus, has supplanted the mutant Delta in the UK. On Saturday alone, 10,059 new Omicron cases were reported. So the highly contagious Omicron mutation has become the dominant variant of the coronavirus in England. Omicron now makes up 60% of all cases in the country, said British Health Minister Sajid Javid in an interview with Sky News. The variant had spread rapidly in recent weeks. As I said, on Saturday alone, more than 10,000 new Omicron cases were reported in the United Kingdom, 3 times as many as the day before. Omicron is, by the way, already dominant in Scotland. In order to slow the spread of Omicron in Germany here, the federal government has declared Great Britain a virus variant area and thus drastically restricted entry from the country since Monday. At the same time, the debate about stricter corona measures is coming to a head in Great Britain, where far-reaching freedoms still do apply. According to media reports, discussions are ongoing about a kind of breakwater lockdown after the Christmas days. Scientific advisors are calling for the measures to be tightened as quickly as possible in order to prevent the health system from being overloaded. One is almost certain that there are currently hundreds of thousands of new Omicron infections per day in England, so a high number of unreported cases. According to The Guardian, some modelers warned that without stricter measures, there could be up to 2 million new infections a day by the turn of the year. Boris Johnson's government still hopes to be able to rely largely on the protection of the vaccinations. Health Minister Javid tightened the tone against the approximately 5 million unvaccinated, about 10% of the population. You really need to think about the damage you are doing to society by occupying hospital beds that could otherwise be used for someone else, maybe someone with a heart problem or surgery, the minister told Sky News. To protect against the rapid spread of the Omicron variant of the coronavirus, the UK, as I said, was classified by the federal government as a virus variant area since yesterday. And this includes Northern Ireland, the Isle of Man, and all Channel Islands and British Overseas Territories. The classification is initially valid until January 3rd, but can be extended. The German Robert Koch Institute announced this on Saturday evening. This considerably restricts entry to Germany from Great Britain. Airlines are essentially only allowed to carry German citizens or people living in Germany from Great Britain to Germany. But it is not a flight ban. The rule also applies to rail or ship traffic. In addition, a PCR test is required before departure, and one can also be carried out on arrival. So far, South Africa, Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, and Zimbabwe have been virus variant areas. New German Federal Health Minister Karl Lauterbach told the German press agency about this. Making entry safer helps so that the Omicron variant does not spread so quickly. We cannot prevent the spread, only delay it. The longer it takes until Omicron also got Germany under control, so much the better. Great Britain reported a new high on Friday with 93,000 new corona infections, and on Saturday there were a good 90,000 new cases. The number of hospital admissions is also increasing again. The increase in Omicron cases is proceeding at a terrifying pace. As I said, more than 10,000 new Omicron cases were reported on Saturday, 3 times as many as the day before. In total, there are around 25,000 confirmed Omicron cases in the UK. France has already introduced restrictions on travel to and from the UK, even before Germany did that. They are only possible for a valid reason. Business trips and vacation trips are not included. Criticism of the classification comes from scientists. English medicine professor Christina Pagel wrote on Twitter, "A complete waste of time. The sooner European countries realize that they are only a few weeks behind Great Britain and deal with a domestic transfer, the better it will be for them." Her Swiss colleague Isabella Eckerle also agreed. Travel restrictions, risk country lists, etc. are a waste of time. Omicron is already everywhere and UK is only a few weeks ahead of us. Much more important, it is to prepare for the wave and to make sense of the remaining time. She wrote that as well on Twitter. Stricter measures are rejected by many conservatives in the UK for ideological reasons. So also from the previous Brexit minister David Frost, whose resignation became known at the weekend. The UK must learn to live with COVID, demanded Frost in his letter of resignation to Prime Minister Johnson. So he needs a tinfoil hat. Well, he was said that the lifting of the COVID restriction had not turned out to be irreversible as promised. I hope that we will soon get back on track, he wrote. But contrary to this view, London's Labour Mayor Sadiq Khan had declared a disaster situation on Saturday afternoon because of the rapid spread of Omicron in the British capital. Khan pointed out that the number of COVID-19 patients in London's hospitals is increasing massively again. The number of cases is particularly high in London, but vaccination rates are particularly low compared to the rest of the country. At the beginning of January, the city triggered the disaster case because of COVID-19 already. At that time, the health system was on the verge of collapse. In concrete terms, this means that special emergency plans come into force and that the units involved coordinate more closely. The Guy's and St Thomas's Trust, the GSTT in London, is one of the largest hospital operators in the British capital. Due to the rapidly increasing number of new infections with the Omicron variant of the coronavirus, there is now a staff shortage in the clinic company, reports The Guardian. Hundreds of employees with an Omicron infection would have reported sick. As a result, non-essential surgery has been suspended until further notice, as staff from other wards are used in intensive care units and to care for acute corona cases. This development is also of concern to the German virologist Christian Drosten, who is a member of the specialists at the Chancellery. The chief virologist of the Berlin Charité shared the report of The Guardian on Twitter and wrote, "This is how it starts." According to the Fire Brigade Union, which operates the rescue service in London, the rescue workers are affected by an unprecedented number of staff absences. Up to a third of the vehicle crews were not operational in the past week, according to The Guardian. In an internal message distributed on December 17th to the employees of 2 GSTT emergency rooms in London, it said that new admissions with COVID-infected people had risen by a third, which can also be measured by the number of sick employees and also their absence. The number of Omicron infections is, as I said, currently doubling every 2 days. 60% of the new cases are due to the new variant. London is again the center of this storm, it is said. Doctors now fear that the new wave could lead to more bed occupancy across the country than the record number of 39,254 corona patients in British hospitals on January 18th. On Friday, 93,000 new cases were reported for the UK, an increase of 39% compared to the previous week. If the numbers stay that way, up to 130,000 employees of the British health system could be ill with corona at Christmas, warns the British Medical Association. That would be a tenth of all employees, according to The Guardian. In Scotland, the Omicron variant has replaced Delta as the dominant variant as well. This was announced by Scotland's First Minister Nicola Sturgeon on Friday. 51.4% of new infections are said to be due to Omicron. The tsunami is now starting to hit us, said Sturgeon, and she said, stay at home a lot more than usual. Before and after Christmas, only 3 households are allowed to meet in Scotland. Further measures are currently being discussed. And in a letter to the Prime Minister, Nicola Sturgeon said urgent financial help was needed to protect businesses from the economic shock. She said the huge number of people likely to be infected could overwhelm the NHS and other critical services. And she said more restrictions, while undesirable, may now be unavoidable. New guidance to help limit the rapid spread of the Omicron variant has been published in Scotland now. Since Friday, businesses were legally required to take responsible measures to minimize transmission of the coronavirus. The guidance will support businesses to put in place a range of public health measures that will help keep people safe, including enabling home working, so working from home for those who are able to work from home, something that is key to breaking the chains of transmission. Masks should be worn in all businesses, and retail and hospitality businesses should consider reasonable measures to reduce crowding and manage queues. Workplace testing is being extended, and businesses with more than 10 employees are encouraged to sign up to receive free lateral flow test kits to ensure staff are able to test regularly. To help mitigate further economic harm as a result of this vital public health guidance, a £100 million financial package for eligible businesses is also being established to support them through this period. £100 million for self-isolation support grants is also being made available to those who need it. The Economy Secretary is engaging with affected business groups, and details of the funding is to be set out shortly. And Economy Secretary Kate Forbes said about this, "The Omicron variant is spreading at a rapid pace, and we have had to work extremely quickly to get revised guidance in place for businesses to take effect from Friday's December 17th. It is crucial that everyone follows this guidance to support businesses to keep their premises safe and prevent transmissions of Omicron, especially as we ramp up booster vaccinations. Please get your booster. Test regularly, follow the guidance, wear a mask, and distance from all people when you're out and about. All of these layers of protection will help to limit the spread of Omicron, especially as we approach the festive period." And I just have to agree with her. I had to go to the city center today to get something for my job. Sometimes it is essential and you can't stay away. I tried to stay away from city center and many other places in the recent months, but today it was unavoidable. And what I saw was, not what I wished to see. Because we even have a mask requirement in the central city center, because during the Christmas time business is expected to be quite crowded. So you have to wear a mask outside as well in the city center. And it was really making me terribly angry to see how many people did not wear a mask. And I hope our security forces will collect the fines for that. But they are endangering people. They still haven't learned the lesson. There are rules, stick to the rules. And to the rest, get vaccinated or get your booster. I will get my booster today when you see this video, a few hours later. I'll see you in my next video. Bis gleich.